Howdy folks, thanks for tuning in for another Cruise with Smooth. I'm sorry I hadn't been that active lately. Last week was busy. And like, only odd jobs a couple days, but I had a lot going on, rattling around in my mind, a lot of stuff going on in the family. That was just keeping me from thinking about what I wanted to do for shows. So a couple things I wanted to mention. First off, a family member of mine, older guy, got diagnosed with corona. I told y'all about that. He recovered. He went into a nursing home for rehab to help get his strength back, and he just went home yesterday. So even a guy in his 70s beat this thing. He didn't end up on a respirator, thankfully, but he was not doing well for several weeks. I just thought that was pretty cool and very good that he that he beat this thing. Another thing that I wanted to kind of talk about a little bit more today with all this coronavirus is all the states that are reopening. They're seeing spikes in confirmed coronavirus cases. Now, my take on that is twofold. First off, with this virus, everything we think we know is that you are most contagious before you show symptoms for a multitude of reasons. That's when the virus is at its highest rate of reproducing, before you've started an immune response. That is, you don't think you're sick, so you're not taking full precautions for whatever situation you're in, and no one else is avoiding you. So the virus is most contagious during the initial stages when you're asymptomatic. Well, with these states that have reopened, and to my knowledge, so far there have been 2 that have eased restrictions at this point. I don't think that the easing of restrictions is the only part of the story. When we first started all this month and a half, 2 months ago, when things started closing, we were only getting, so many confirmed cases because you had to show every symptom, and you had to be doing pretty poorly in order to get a test. And even if you were around someone that had a confirmed case, but you were asymptomatic, it was difficult to impossible to get a test. Well, testing ramped up, and more cases were showing. That's kind of expected because, okay, if you had every state in lockdown and minimal person-to-person transmission, you're going to have so many cases. Well, we were basically just able to test all those people and get actual case counts. Okay, that's kind of what we were expecting. Well, ever since... Sorry, I got a text message, folks. Ever since that time, testing has become more and more prevalent, and so more and more tests are getting done. So there's probably more person-to-person transmission going on in states like Georgia and Indiana that have eased up their government restrictions on all this. But there's more testing happening every day. So I'd be curious to wonder if you take a state with similar population and population density to, say, Georgia or Indiana, and ran their test numbers day to day versus Georgia and Indiana's test numbers day to day when they opened, what the percentage and difference is if the same number of tests are being ran. I'd be curious. I don't know. I think that a lot of it is just increased test results or test results coming back, because it's not an instant turnaround on these tests. There's days to weeks of turnaround in a lot of cases on these test results. One of the podcasts I was listening to, you probably figure out who it is. The guy's wife is a doctor, and she explained a lot of the methodologies for testing, and a lot of these test setups, you have to have so many test kits in order to run the test machine, because you're testing hundreds of these at a time. So if you were the first person to take a swab, you might be waiting several days before that particular lab gets enough to run the machine to test them. So I think that the uptick in confirmed coronavirus cases is not surprising for two reasons. You've got more people mingling, so there probably is a little bit more, but I don't think it's by the order of magnitude that I don't think the order of magnitude can be attributed solely to that particular state or locality reopening things. I just don't see it. Because a lot of the people will already have some sort of immunity. Doctors are not sure what the immunity response or prolonged immunity response is, how effective it is, how long you have it. A lot of times if you have, say, a common cold and you sniffle, you have a sore throat, whatever, for a couple days, you'll have immunity from that, but not for really long. Things like specific strains of flu virus, due to the increased immune response, you likely it's been proven that you have a longer immunity to that due to the body's more intense immune response. You run a fever, you have chest congestion, you have aches and pains and everything else, and so not only is your body's immune response greater, it kicks into more of an overdrive, but your immune system, remember, keeps the antibodies around for that flu a lot longer. So there's a lot of people that already have immunity to one degree or another from this disease that are walking around that have had it, never had any complaints. People that I know have had it and had varying degrees of response to it. An acquaintance of mine, his wife had it. She's relatively young and healthy, and she was nearly needing to be put on oxygen. So she had it pretty bad. I know my uncle had it. He was already on oxygen, but he was getting winded a lot easier. I know some people that have just, I had a little upset stomach, or I had a little this or a little that, and it kills some people. So not everybody even responds to this the same way. So even among healthy people, because one of the people that I know that died was a little older, but not in the age category that you would call at risk. And she got it, rapidly went downhill, and ended up dying from it. So there's variables in this thing that scientists don't know. Another thing they're talking about is the possibility of blood type having something to do with it. there's a lot that we don't know about this coronavirus yet. Something else I wanted to kind of mention in this recording is Sweden's response to coronavirus. They haven't shuttered anything. They have made a way for those that are in known risk categories to take off work and socially distance and stay at home and all that. But they haven't shuttered their economy. Anyone under the age of 65 or that has that does not have pre-existing conditions, there's a few recommendations that they're encouraging. Restaurants operate at less than full capacity. People to wear masks and up the rate that they use hand sanitizer at. Okay, that's fine. But they're not shutting down their economy and everything to take care of this. People in risk categories or over the age of 65, they're saying, here's the risks, here's the risk categories, use your own judgment, and they're kind of going about life as normal as possible. They're still going to work, they're still doing this, that, and the other. There's rumors that when I end up going back to my job, there will be certain things in place for our safety. I don't know how long it's going to last. Working in a hot factory in the summertime, I don't know how feasible some of these precautions are going to be, but they're trying, and we'll just have to see. But if everybody in if within 24 hours, everybody in the United States could be tested for coronavirus, and the serum test that analyzes your blood for the coronavirus antibodies, I would love to see the data. If you were operating with a full data set, you'd know how many people roughly, or within a few thousand probably, had it. How many people had active cases, how many people had not had it. And you could figure up your hospitalization rate, your death rate, or serious health effect rate, or no effect at all rate. That would be very, very interesting to me. I think if we knew that piece of data, we would be highly surprised. And highly shocked that our governments at the state level did what they did. I really do. And I could be wrong. I am not a epidemiologist. I'm not a virologist. I'm not a health nut. I'm not a health care. I'm not knowledgeable on healthcare aside from like first aid and kind of common sense stuff. I've nursed kids through, cuts and scrapes and bumps and bruises and just kind of normal kid stuff. Nothing serious. I think the most serious things that my wife and I have dealt with our kids, we had one kid accidentally get a hold of some magnets several years back, swallowed some magnets, and dealt with that at the hospital. And then we had another kid that same kid a number of years later had to have her appendix out. And we had another child that had a absence seizure earlier this year. And none of it ended up being anything major. The appendix, it was just something that came on kind of sudden. But had her appendix out and piece of cake. She recovered as well as expected. She did very good through her recovery. Just had to remember to take it easy on her for a couple weeks while she was healing up because she was sore. But I'm not an expert in any of this. I'm just using common sense and looking at data. I do think that China lied to us through a lot of things on this. So I don't. If data comes out of China, I'm sitting there thinking, yeah, right. So I don't trust China's data. I do think Sweden is probably the best model for all this. I wish that the United States would move rapidly to try to do something like that. I think that with this coronavirus, that a certain percentage of the population is going to get it no matter what you do. You can just spread it out and flatten the curve so that you don't overwhelm the medical system, which is a good thing. But I don't think that without there being a vaccine or preventative care or a proven treatment regimen, I don't think that you're really going to be able to do much to prevent person-to-person spread if this thing is as transmissible as we're led to believe. So, anyway, that's kind of what I got for today. That was what I wanted to talk about, and maybe shed some hope on all this, that, you know, even someone who's got serious health issues with their lungs and had some other pre-existing conditions that put them in risk categories beat it. That it's unpredictable in the way it's going to impact people. And there's a lot that we don't know and understand. So, hope y'all have a good day. Stay safe out there. Thanks for tuning in for another Cruise with Smooth. Like, share, subscribe, comment. Going to be heading up to Danny's one day next week. And we're going to be doing a show of I'm No Expert. By the way, my cough is... I forgot to take my allergy medication for a week because of who I am as a human being. I'm terrible about remembering to take pills on time, so... Anyway, y'all have a good one. Stay safe. Catch you next time.